I'm born in Persian, like Iran, and then I came here to California in 2015. I think mostly was like educational purposes, and then also the situation back in home was not great environment, so we decided to move together.
I am originally from Albania. Government back home just plays a big role and just how things work there. People don't get to what they work for as easy as I thought that it will be here.
I'm from Iraq. My main point to move here is looking for a better future for my family.
I was born and raised in Germany, and now I live in the US. My parents are originally from Nigeria. I think that they believed we would have a better life here, where we perhaps would be maybe more socially accepted, or we'd see more people who looked like us.
Originally from Syria. The main reason is because we have some political conflicts in Syria starting in 2011, which turns out to be a civil war in mid-2014.
I hail from Andhra Pradesh, which is in south of India. I was always interested in furthering my education in the United States, considering the advances in research and technology.
I belong to a minority ethnic community called Hazara in Pakistan. For the past 3 decades, Hazaras in Pakistan have faced ethnic cleansing and genocide, and it led to the death of hundreds of people and left thousands disabled. People who could avail an opportunity for a safer life with their families moved out of the country, and I was among one of them.
I'm from Palestine. I came for the US to pursue dentistry. It has more promising opportunity for dentistry here in the US.
I'm from Cuba. The main reason I came into the United States was opportunity. I was a dentist back home, but not necessarily you can make a good living out of it. And you also want to be able to help your family, to support yourself, and have better opportunities.
After finishing my education in Egypt, I started practicing as a general dentist there. I saw some charming and some really good lecturers and practitioners in the US. There where I decided to come and learn more, expand my knowledge, and maybe getting a better future for myself and my family.
I am from Jordan. I got married and I came with my family. My husband, he's a citizen and he has business in the USA, so that's why we came with him.
I was born and raised in China till I was 16 years old. Then I came to States with my mom and my brother. At the time, my mom remarried, so that's why we came.
I am from Barbados. I knew from a pretty young age that I wanted to be a dentist, and unfortunately there's no dental school in Barbados, so I did have to venture out, and I chose the US.
I'm from Nepal. In order to find better education and opportunities, I came to States in 2016.
I'm originally from Iraq. It's for safety purposes because back home it was unsafe environment, and we got life-threatening letter, so we had to leave.
The culture, culture shock, and then also English was the big part to just, adapt and learn.
We have a certain concept about how America will be, and then when you get here, it's like, oh, it's just another normal place. I didn't speak any English when I got here, so not being able to communicate with people, and let alone to understand their culture and how they perceive certain things.
The language barrier and a couple of cultural difference, social difference from here and over there in my country.
I was more aware of my race while I was here rather than in Germany. And I know that sounds funny, but I always knew I was Black in Germany and that they were white for the most part, but it didn't really prevent me from doing anything, or I never felt like I was being categorized. But when I moved here, I instantaneously felt that at my high school. That also prevented me from doing certain things educationally that I wanted to do. So I had to stay in college prep classes instead of doing AP or IB courses.
It was a little difficult to study in English since we are taught in Syria in Arabic. Everything is translated to Arabic. I was looking for a job related to dentistry in New Jersey. People here assume that they're going to see a female dental assistant. So for me as a male, it was difficult to find. So the first couple of years I have to work to jobs not related to dentistry.
I had to manage both my education and also about my family.
United States is very diverse, right? So while I was sharing part of my culture and learning and adapting to different and new cultures, I was also struggling to keep the originality of my culture. I feel like I still struggle to that to some extent.
Here, I feel like it's harder to communicate with people on a personal level. You need to know the person more in order to communicate. Dealing with different patients from different backgrounds as well, talking to them, understanding their culture, understanding their needs.
Trying to blend into the new society without losing yourself, without losing your identity. So I wanted to make sure that I was able to respect cultures, religions, but I was always wanted to be understood. I studied English, but I wasn't fluent when I get to the States. So I was able to understand, but I wasn't fluent, like speaking, I wasn't fluently. So that was one of the challenges, but I overcome.
Out of the airport, I see like snow everywhere. So that was something extreme for me. I've never been in such a weather. The English that I used to practice back there in my country was a different English. So there's more accents, there are different people from different backgrounds, and even people from the US, they're coming from different parts of the world.
At the beginning, it was like a culture. Christmas, Halloween, everything is different. Some people, they ask me like weird questions. Are you wearing hijab at home? Are you taking shower with hijab? But now I feel that people, they look at me, I don't feel any difference between me and any other. I feel comfortable, I feel confident.
I think the hardest part for me is to have like-minded people, have a good support system.
Changing the spelling to an American spelling versus British spelling.
I think when I came to the United States, it should be like the fast-paced life over here. There's a focus on individual growth rather than the collective growth.
It was the communication. We studied in English, but then to communicate and the accent, it was really hard. So it was a really big challenge for me to understand accents.
Everyone that coming from that part of the world in Middle East, they think all are Muslim and like all are religion. Well, which is not true, was not true in my case. I'm Zoroastrian, so like many people in Persia are Zoroastrian.
They will ask me, where are you from, when they hear the accent, and then they'll be like, from Russia? And I'm like, no, from Albania. And they're like, oh, but you speak Russian. And I'm like, no, I speak Albanian. But is that like Russian? No, it's a totally different language.
Whenever you said like Middle East, they thought like people there, they live only on desert and they don't have any big cities or highways or any technology there. And some people even thought like they still use the camel to go to the work. Most of the Middle East, no, it's like a big city, have a lot of technologies and brand new cities, some of the countries.
The misconception could be that we had to fill up a percentage of Black people to, to have diversity ratio.
Was originally from Trenton, New Jersey, born and raised, but prior to coming to PDM, I lived in Washington, D.C. Coming into dental school, I remember when I gave the notice to my supervisor prior to leaving my previous job. And one of the comments that he made to me was, you must be really smart to have been able to gotten into University of Pennsylvania. Just to kind of have that comment thrown my way was a little, it just really didn't make me feel good about myself or my capabilities after really reflecting and thinking on what was said. Although I'm sure he said it with good intentions, on the receiving end, it was not a compliment or anything positive.
I'm from West Hartford, Connecticut. I think that a lot of people like to make jokes and make stereotypes about Jews, things about big noses, people having a lot of money, people having a lot of greed. I think that those are very offensive. I think also a lot of misconceptions are that we have a lot of holidays and we're just taking off a lot of school time, but that time that we're spending with our family is a very spiritual experience, and it's time to bond with family because we are so tight-knit.
Some people here, they like to generalize. They think that people coming from Middle East, they have one religion or one ethnicity or one language. Actually, Syria is pretty diverse country in terms of religion and ethnicities. Some people think that we don't have like equal rights between like men and women, which is not true. In Syria, we have a secular system there.
I'm from Morris, Illinois, which is a small town outside of Chicago. Most faculty didn't know I came from a non-traditional background. And for better or worse, they thought I was the same age as all their other students. I'm actually a first-generation college student. So the road to coming to Penn was different than many of the other students.
People think all Indians speak one language. We speak like more than 100 languages. We are diverse and we have different interests too. And people always think we are either from IT or tech, but we have different interests, and a lot of us are dentists too.
I think as a Muslim woman who wear hijab, one of the misconceptions is that they are forced to do so. It's a personal choice. If a woman decides to choose a modest lifestyle by wearing hijab, cultural norms and values are misunderstood with religious values. Definitely, there are many dominating societies where women are not given the opportunities to practice their basic rights. But those cultures are not reflective of Islamic values.
People think that we are all Muslims from that region, and for me, I'm not a Muslim. For example, I'm Christian, and I'm coming from an Arab Christian family, and there is a huge Christian community in a lot of Arab countries.
People don't associate Black population and the Latino community. They don't know that there is a huge Black population in the islands. In my case, Cuba, but also Dominican Republic, Puerto Rico.
I had the beard, and whoever talks to me thinks that I am closed-minded person. They think that they cannot communicate with me like the same as any other person. My personality has nothing to do with how I look like.
Some people think that women in my country, like, they have no rights, but I want to tell everybody that women in my country, they have rights. They can work, they can learn, they can go to university, they can be themselves.
I do think each student have its own background and its own story to tell. And I think over-representing them, categorize them into big, umbrella term Asian. Like, I think that is not doing enough work of digging and getting to know the students. I'm an immigrant, but I'm also a veteran. I had more stories to tell than I am just an Asian.
People, I felt at the beginning that they tried to put a wall, like not get really close to me. I opened up conversations. I was more open to listen to their idea and their, like, what they think about my culture. And I had a tremendous amount of questions from them about my culture and everything. So I was always trying to explain how we are, like we're all the same.
Persians are very friendly. They're very friendly, very warm people, always trying to take care of people.
We are very welcoming, very loving people. We have a beautiful, nature, and we belong to a certain culture. But then in the meantime, we have our own journey.
In every culture, in every group, there is a good people and bad people. Iraqi people, like especially Iraqi people, they are very friendly, very lovely people, and they are passionate to live their life and build their future.
I consider myself to be a Black American. We were always taught just to be hard workers, be honest, and to help folks. My mom is a nurse and my father's he was a retired firefighter. So ultimately, from a value standpoint, they raised me no different than what I see any of my other colleagues.
Maybe not exactly just about Judaism, but about all religions in general. I would listen with an open ear. So I may practice differently than how someone else practices, but that doesn't mean that either of us are wrong. And placing judgment on that is something that I've experienced a lot.
We love to share with our family and friends all our happy moments. So we do it in a big way.
They are very hospitable and they go above their way, beyond their way, to make people comfortable and host them.
We are family oriented. We pay so much attention to relationships with family, close one, and friends.
It's kind of like a melting pot. We have all these mestizaje, what we call mixed races. We were colonized by Spain, but we also have slavery and also indigenous.
We love being around people. We are love to accommodate and have guests. We make friendships very easily, and we get to know people, and we are open to get to know more people.
I'm from a small farm town in the middle of Michigan called Chesning. Growing up, I was always people would ask me, they'd be like, well, I don't really know what you are. What are you? You just have to embody yourself and really find yourself. And for me, being loud and proud in those identities is important, not only for myself, but also for my career. And because you're going to have people that look like you and have those identities and coming into your practice.
Caribbean people, West Indian people are very lively and we love to have a good time, but we're also very intelligent. There aren't very many opportunities in the Caribbean. That's why a lot of us venture out, but I do think that we have a solid foundation.
Buddhism is what we follow. We should always do good to people. If we do something bad to people, then it might come back to us. That's how we act, I guess.
If you sign up for it, to be there, just be there 100%, not on your phone or trying to avoid student or when they want something, you take so long to come and help them. I think that's the main thing. Any criticism would be great to not be in front of patient or not be loud in the clinical floor.
Once you understand that a student just wants to have directions and then they want to apply it, to let them do that and to kind of guide them from afar. And then if there are students that want hands-on help, then you do that. In this fast world, we also forget how important it is when faculty members or anyone that is teaching us something connects with us in that personal level too, because then things and lessons make a different sense and they're stronger and they, I think, impact us a lot more than when we are taught just, as a number.
Oftentimes you can see different people working at different paces. I've had instances where faculty members yelled at me because they said I wasn't understanding how to perform my hand skills fast enough. So I did not really enjoy that. And it's happened to some of my other Black peers as well.
When you run into instances where you have, one approach with one student, another approach with another student, personally, I think that's where the waters get a little muddy. We're human, so we may have a liking to one person more so than another. Our unconscious biases may kick in when it comes into just our personal values and in how we relate to others. But I think kindness is key, treating people the same way that you would like to be treated, but then also being consistent across the board.
I think that something that would really help is faculty members discussing the reason why they're doing something. When you're first learning, you just do what they say, but then over time, you want to become an effective clinician yourself. And so you want to understand why they're doing what they're doing and why they aren't using a different material. They don't necessarily always ask you what you think is best. And of course, we're only, students, but it could be helpful for them to ask us what we think is best. It really is helpful for us to think about how we would do things in the future since we are graduating in just a few months.
I would like to ask them to not generalize or assume anything. When you have international students, it's preferable if you don't ask them if they're going to go back to their own country after they graduate, because every person has a different situation. Some of them, they don't feel comfortable to say that we are here refugees or asylee, or we can go back to our countries.
I think it's important for faculty to meet students where they're at really individually, to know them as people, not just their name, but a little bit about their background, and then do something to really remember it. I would say the majority of students are really trying to put their best foot forward. So when we make a mistake, we're asking questions, it's not necessarily because we're not trying, but rather because we maybe don't know the answer or we're curious as to what the answer may be. In dentistry, there are several different ways to do a single procedure. So asking, what are other ways to do this, isn't necessarily challenging what they're asking us to do, but rather trying to understand the breadth of dentistry.
My advice would be that not to make assumptions on people regarding their nationality or their ethnic background. Instead, put an effort to make the people individually. We are just like anybody else. we feel the same warmth and affection towards others as we do towards people of our background.
For foreign trained dentists, we are less assertive when we approach faculty members, and that might create a confusion that we are less interested or in certain things. That's totally wrong. We are very interested in learning new things. Also, assuming that foreign trained dentists doing this program know everything and does not pay attention to us, I think that's totally wrong. We want to learn all the new things, and we are sometimes do not know certain things, and that sometimes create a problem between us and the faculty.
I will advise faculties not to make assumptions of how much we know or how much we don't know. It's nice as a dentist to be recognized on that, yes, you know, I trust you because you've been doing this before. But what if maybe I just didn't have that much approach to certain procedures?
We need some patience. As a student, you're working with one patient and you are expecting to deliver the best care to that patient. So when you talk to your faculty, sometimes they get like a little bit tempted or annoyed because you did something or you didn't do it the way they said exactly. That will make them like maybe criticize you in front of that patient. That would make me feel like little like discouraged.
I would like to see all faculty are more strict and focus on every single details. Like I like the faculty who focused on even the notes. When we write the notes, they come and read the notes, read what we have to write. Maybe I know how to do this, but maybe they're gonna teach us a new technique, easiest technique, more effective technique.
I'm sure students want to do the best for the patients. So I think just keep that in mind when you are approaching a student. If they seem already stressed out, don't try to aggravate the situation by yelling at them, especially in front of the patient. As a faculty in clinic, it's really important to cultivate confidence for new generations of providers.
Obviously, you can't rope the patient in on the whole thing because there's going to be some stuff that like is just not necessary for them to know, but like before they leave, like reconvene with the patient, and that way everyone's on the same page. Introducing with pronouns, that's something that I notice with clinic. Like I'll come in and I'll be like, my name is Riley, my pronouns are he, him. And that way you're not prompting people, you're not forcing them to share them if they don't have to, but that way you're kind of opening up that space that makes them feel comfortable to share them. And I think that's great too.
It's not always what you say, but how you say it. I think it's very important to be encouraging to every student, no matter how they look, where they're from, if they like you or not. I think it's very important to give feedback in a way that someone can learn from it, expressing it in a way where, you know, you can learn, but still you're kind with it.
Having a little bit of patience from the faculty side. At first, like you don't have like that command over the English language, so like we are pretty slow. Like sometimes we get stuck at some point, like whenever you are in conversation.
It will be nice if they try to know us more. I have that shying personality. Like I'm not that person who's gonna jump and talk and open a conversation.
Currently, I'm doing the dual degree at DMD and the Master in Law. I'm in law school and dental school. My plan is like basically go to private practice, work as a general dentist, and also like use that Master in Law for the contracting or entrepreneurship.
Opening my own clinic and treating people from different backgrounds and making them feel understood and making them, educate them.
To start practicing right away as a general dentist, maybe in the next 5 years, I will get another specialty other than the perio. Hopefully, I will be success as a great parent and super dentist.
I will be serving in the military for 4 years as a part of my scholarship obligations. And I'm very interested in 2 specialties. Just be happy, have a wonderful family, create a community, be a part of a diverse community, because I identify with a lot of my experiences in Germany as well as here. So I just like to have a little bit of everything around me.
I really just want to help people and then also just have like an impact on people. That's my aspiration for the future, as well as also inspiring other boys and girls that look like me to go into the profession. It was something that I didn't have growing up.
So I'm doing a dual degree, getting my master's of public health at the same time that I'm getting my DMD. And based off of that, I want to be able to be an advocate for children's oral health in the future. So potentially being on a state licensure board or something like that to promote health for children is something that I'm very passionate about.
I'm planning to specialize in endodontics, and my future goal is to continue in academia, research, and teaching. I'd like to teach.
I'm hoping to open my own practice as soon as I can. I will be doing 1 year of residency, and then after that, we'll see the world as my oyster, I suppose.
I want to become an exceptional clinician, so I want to better myself every day, and eventually I want to start my own practice and start treating patients in best possible care. I would love to travel the world with my family and also teach my kids about our culture and all the best things in life. Yeah.
As a dental student, I definitely want to excel at my skill and be a good, skilled, and knowledgeable provider, and a good wife, mother, and a responsible daughter, and on the top of everything, a kind and humble human being.
So my plans and dreams in the future is to be a good clinician, helping people. I'm going to the graduate program. I'm going to be an endodontist.
Be an excellent professional. I'm a Latino person, but I'm also a Black person, and I'm an immigrant person. So I kind of want to incorporate those and be in representation for those communities that could be represented by my persona.
My dream is to be a great practitioner and to deliver the best care for my patients in the future. I would love if I can have that opportunity to give back to the community, help these people with who are living in underprivileged areas or with low socioeconomic status.
I will be going back to the Army serving as a general dentist because of my own dental trauma when I was young. I am more interested in aesthetic dentistry. I do want to own my practice one day and focusing on that.
So I'm a part of the NHSC, and I think my plan for these initial couple of years is work in a federal health clinic. In the long term, I could see myself being there, working with underserved communities. I really would like to make a show about oral health. I want a show where not only can adults enjoy it or and kids can enjoy it, but you learn something from it and you're not just oh, you gotta brush your teeth and floss.
10 years from now, I just want to be happy. I want to be really happy and settled with children. And I'm not exactly sure which field I would end up in, but I genuinely hope whichever one I'm really good at.
Right now, I would just want to join a private practice at somewhere, but 5 years down the line, I certainly want a clinic of myself, go more forward to the business sector and a little bit.
In the future, I am dreaming of being an orthodontist, and I'm fighting for it. And of course, doing good in my career, and raising a good child, and get him also to think about education, following his mother and father, because we're both dentists and we work hard. We want to provide him with the best living.